Hi everyone, Dr. Houghton here. Since March is Colon Cancer Awareness Month, I wanted to give you a description of the different tests that are FDA-approved colon cancer screening tests. First is the colonoscopy. This is considered the gold standard screening test for colon and rectal cancer. It is the only test where we can find both colon cancer and, at the same time, find and remove colon polyps, which are the precursors to colon cancer. No other test reliably detects colon polyps at this time. The negative aspect is that you have to drink a bowel prep and be sedated for this procedure. There are also rare risks of complications from this procedure, including perforation, bleeding, or aspiration. However, these are super rare under adequately trained hands, so always go to someone who regularly does these procedures, but do not get them done by someone who does 30 colonoscopies in a day, because there's no way that a doctor can do that many scopes in one day and still do a thorough exam where they find polyps. This test should be done at 10-year intervals only if there are no polyps found and there's no family history. Next is the Cologuard. You've probably heard of this or seen the commercials with the talking box. This is a test where, yes, you have to poop into a container that you then put into a box and mail back to the company. The benefit is that it is very accurate in detecting if you have colon cancer and it is non-invasive. The downside, it is not accurate for detecting colon polyps, which is what you want to find to prevent the colon cancer from developing in the first place. This test is done every 3 years. Next is the FIT test, FIT. This stands for Fecal Immunochemistry Test. It is a test where you put a small sample of your stool using basically a Q-tip and put it into a tube and mail it back or bring it back to the lab. The positives for this test are that it is simple and not expensive and is fairly good at detecting colon cancer. However, like Cologuard, it is not accurate at detecting colon polyps. This test is done yearly if that is the screening test that you choose. There's also the virtual colonoscopy. This is actually a special type of CAT scan that uses technology to look inside your colon and find polyps and cancer without having a doctor use a tube. The positive is that it is accurate for both colon cancer and polyps and is less invasive than a colonoscopy. You also do not need to be sedated for that procedure. The downside is that you still have to do a bowel prep, and if you do have polyps, you would then need to have a colonoscopy done, and if the institution does not have a way to get you directly to a colonoscopy that day, you would then have to be rescheduled and do yet another bowel prep. Finally, there's the newest screening test for colon cancer, and it is actually a blood test called SHIELD. This is recently FDA approved, and its big benefit is that you do not have to do a bowel prep or collect a stool sample. The downside is that it is not quite as accurate as Cologuard for detecting colon cancer or colon polyps. Hope that helps. Be well.